Hi, everyone. This is Jackie Cooper with the GBA Talk Show. I want to welcome everyone to this episode. I want to remind you to like and subscribe to GBA and to definitely check out the gbaglobal.org website. It's a wonderful organization that provides education and resources for those that are in the blockchain. And if you're in the government or in the private sector, you can network with individuals and learn more about the use cases that are happening on the blockchain, as well as the solutions that are being provided to the problems that we seem to have at different times. And with that, I want to just share a little bit of background about me, and then I'm going to hop over to my guest. For those that have not been following me on my own social media, my name is Jackie Cooper, and I'm Crypto Mom too. And my background's, I'm an attorney. I'm also an author. I've written a series of books, Bitcoin Cinderella, Blockchain Adventures. And I'm also a blockchain consultant on a variety of topics. And I became involved with GBA because of I love to meet people who have been in this world a lot longer than me in terms of the blockchain space. And I am learning so much from them. And as a result of what I'm learning, I'm trying to pass it forward to the students that I have, because I'm also a teacher. So that way, those that are coming up the ranks can also learn about these new career paths so they can be the next generation of leaders for us. So Anthony is also part of GBA, and his company and what they're doing really blew me away, because when I first started in law, my background was in the health field. I was all about patients' rights and, a lot of other areas in healthcare. And what they're doing is integrating blockchain in a way with the health sector that I think needs to be looked at. So I'm not going to kind of spoil the surprise, Anthony. I really appreciate your being on. I would like you to share a little bit about your background and a little bit more about what you are doing, because I think it is definitely needed in our community. How are you doing today?
Well, thank you very much. It's a pleasure to be here with you today. I'm Anthony Begando. I'm the co-founder and CEO of Procredex. And, I think it would be helpful to give a little context as to where we got here, because it was a bit of a winding road. I ran a consulting firm in Atlanta for many years, and a large chunk of our business came from helping very large health systems, very large health insurers, and ultimately the U.S. Military on the reserve component side, fix broken credentialing operations. And if you've never heard of the term credentialing, what that essentially means is reviewing everything about someone's professional education, history, work experiences, training, and so forth, and confirming that someone can actually do what they say they can do. It's a very, very important process. It's performed in most regulated industries. So whether you're in healthcare or you're in the oil and gas industry or you're in aviation, people who work in those fields must be credentialed, right? Typically, the credentialing process has been, you sign a contract for employment, you get handed a checklist document that says, here's all the stuff I need to get from you. You hand over a stack of paper to somebody, and they begin contacting every source of that information manually to confirm that you actually did go to medical school, you did get a fellowship at this place, you worked at this location from X to Y, you've taken this training and to perform these procedures, and so on and so forth. It is a very, very cumbersome process in healthcare, and it typically takes anywhere from 4 to 6 months for a physician or an advanced practice provider to go from handshake to billing and treating patients. And it's the average for physicians here in the U.S. The average net revenue or daily billing that a physician delivers to a health system is about $10,000 a day. So if you've got a process that's taking anywhere from 120 to 150 days to complete, think about how much net revenue the entire industry is forfeiting for every hire that takes place. It's crazy, right? So in doing this work, we probably about 2014, we began to invest in analyzing why credentialing was so broken and why were there no technical ways for folks to collaborate and share information and not do this work redundantly and repetitively, everywhere in the industry. We found that there were three problems. The first problem is that credentials data itself has no definition. It's completely unstructured. It can also contain data. It can contain documents, images, transcripts, like all kinds of information in a credential, if you will, right? The second issue that we found is that everybody does credentialing differently, and there's a reason for this. You may have a hospital that has a medical, surgical, or med-surg department that performs a certain kind of knee replacement surgery with a very specific set of devices. And if you don't know how to use those devices, you're not going to be competent, and you're going to need to be trained and over supervised and all that. And if you really need a good knee person, right, to come in and join your surgical team, that's not a good fit. Whereas that same person may be a great fit for the hospital down the street, right? Health insurers have different requirements. Liability insurers and malpractice insurers have different requirements, and therefore there's no way to create sort of a common credential set, right? Because the analytics performed against the data and the data itself varies greatly from organization to organization. And the third problem we had was the fact that no one trusts the data that they receive, if you will, because they have no idea where it came from. They have no idea how it was verified, supposedly, or what. So every single member of the supply chain will take this set of credentials information and re-verify it again and again and again. It's absolutely ridiculous how this process plays out. It's needed. It's necessary. It's very important for patient safety and for clinical quality and quality of care. But the way that the work is done has been broken for decades, right? As I mentioned, about 2014, we began building solutions to solve those three problems. The first thing we did is we developed our ingestion engine that allows us to consume credentials data however it exists in the wild and make sense of it, systematize it, if you will. The second thing we built was what we call our validation engine. And this validation engine, basically codifies the specific credentialing rules for every location down to the department and occupation level that are required for credentialing a person at a specific location or device or a company, right? It varies on our platform. We built this, we put a pretty simple UX on it, beta tested it, and we're given some pretty incredible feedback that, oh my gosh, people could begin to see the end of the light at the end of the tunnel. It just so happened that the chief medical officer for Intel was also the chief or the state surgeon for the Air Guard in California. And I reached out to him, about, what we had done. And he basically asked me, have you ever thought about blockchain for this solution? And I had not. I had always, this is, back in 2017, I had always considered blockchain at that point as being more of a crypto,
Exactly.
use case and less of a business application, right? And he educated me very quickly on how blockchain could be used in credentialing. He wrote a white paper about it, and he introduced me to a company in Nashville called Hashed Health. I'm not sure if you're familiar with them, but Hash is probably the global leading venture development studio that's focused on blockchain-based healthcare solutions. And we hit it off like a ton of bricks, and I really enjoyed, their collegiality and their instincts around how we could take what we had originally built and build a platform, based on distributed ledger, into market. We did that, and that is what became Procredex. So, we are we're a company that focuses on primarily ensuring that the professionals that serve our communities every day can do their work, and we can minimize the administrative burdens that are placed upon them. So that's the 50,000 foot view.
No, I love it. So for those that might be new to the blockchain world, how would you define blockchain? I know how I would define it from a crypto or Bitcoin minting side, but how do you define it from an information perspective?
So blockchain solved my third problem I described earlier. It allowed us to build an immutable trust in the data itself, right? If you think about the nature of this information, it's full of PII, PHI. It's all about someone's identity, if you will. It's literally everything other than the financial information about a human being or a piece of equipment or whatnot, right? And when you receive this information, it's so critically important to know that it's legitimate. This is what drove this manual verification of this information across the industry. What we're able to do is ingest this data electronically, hash it as soon as it crosses our platform and firewalls, and know and be able to ensure everyone who's going to be dependent on that information going forward, its source, how it was verified, who verified it, who owns the data, if there's copyright protections on the data, all of that. And that's what we use DLT for, is to lock down the data and build an immutable trust in the information that we have on the platform.
So I'm still going to back it up a little bit. I'm going to talk about the crypto set first, and then we're going to go back over to what you're doing, just because I want some clarification.
Sure.
So when I explain blockchain to people, I always explain it's sort of like Legos getting, connected together. And then I realized in explaining it to a friend, I said, it's more like a train. Every train
Mm-hmm.
has cars, and in the cars there are seats. And when the seats get full, then the doors could close, and that block then is no longer available for information to be put into that block. So the next people have to go to the next car. So, so from a minting perspective, so with what you're doing, you're using information. You're not creating coins or tokens. But
No.
my question is each block one person, or is the information that you're verifying and storing multiple people within a block? And then how do you separate the information within that block if it's more than one?
So this is a very good question. We do not store data, if you
Okay.
will, on the distributed ledger. We hash the data and in its entirety. So, for example, a credential can be 85 fields of metadata. It can have 3 PDF documents, a GIF image, and something else. We take the entire set of data related to that credential, hash it, right? Store the hash and some other information, proprietary information, on the ledger, and then point back to that data in our data set, right? Yeah, I think, blockchain, if it's used as a database, it's being used improperly, right? Because it will rapidly, the train will get real big, real fast, and real slow, right?
Well,
Right.
and you're right about the speed, because with more information on the blockchain, that's why different off blockchain, off protocol layers have been created, so that way transactions or events can happen not directly on the blockchain, because it has been getting slow, Bitcoin and some of the others. So it's interesting what you're talking about. For those that don't know what hash means, can you define it?
It's you take the data in its entirety and you run a cryptographic standard formula against that data to generate a key, right? And that key is immutable, because so for example, you can hash, as I mentioned before, the data, documents, all this other stuff, and put it in a bucket called a credential. You can then take that hash and test that data every time it's used, right? So, and because what we have to be able to tell our members is that we guarantee you that this data has never been modified. If it's a pixel on a PDF document, right, one character in a data field, the hash kicks out the data, and we disable that data, on the exchange. So it is the way that we can drive trust, right, and drive trust and reliability of the information. And frankly, the use case around credentialing is almost an ideal use case for an early solution using this technology, right? Because we were not trying to tokenize value. We were not trying to mint stuff and coins and all that. We were literally trying to find a way to ensure folks that their information was reliable, right? And it was I believe it's been a very good, let's call it V1 use case for this technology in the healthcare industry.
So explain more the type of clients that might benefit from using your services, and how it can save them both money and time, because that's the other thing that, as we were talking before we started recording, it was like an aha moment for me.
So we do not sell Procredex as a point solution, if
Mm.
you will, right? We have to build collaborative networks, right? Because the value from Procredex does not come from one organization using it, comes from an entire commercial ecosystem using it. So let's use healthcare, for example. You know, credentials information is a function of commerce, right? Because, when you hire a physician, you've got to get all their information. Then once you've finished verifying it, you need to send it to every health insurance company you're contracted with, which may be 20, 25 organizations, any telemedicine organizations, outpatient clinics that you work with, affiliates that work with your hospital system. All are going to take this same bucket of information and analyze it in their lenses that they have regarding what's good and what's not good, right? And make a determination as to whether or not this individual is eligible, for lack of a better term, to work within that network, right? What we've done is we've automated that analysis for all parties concurrently, right? So when I'm sending data that needs to go to, let's say I'm a hospital, I'm sending data to Humana, and Humana has their own credentialing requirements for the state or even the county that I live in, right? I know before I send that data to Humana that it meets their compliance guidelines, and when Humana receives it, they know immediately that it meets their guidelines as well. And this whole exercise of re-verifying the same set of information goes away, right? And my colleagues and I we believe that the healthcare industry probably spends over $100 billion a year in wasted time, just doing all this verification stuff, right? And also just the forfeitures and revenue that organizations experience, waiting for this process to play out, right? And this technology and directly enabled our ability to build this solution in a way that helps everybody. It's a think of it almost as a community benefit, because at the end of the day, if your emergency room doesn't have enough doctors, or your hospital is low on hospitalists, everybody loses, right? It's a net loser for everyone in the community, and not just one organization. And as I said earlier, our focus is ensuring that those professionals that serve our community can do so efficiently.
Well, I know that explained, also how long it takes sometimes in the past to check on the credentials. And like you said, the variety of types of credentials. Sometimes, people will do calling, but there's different expectations, of how the credentials are verified.
That's different rules, right? And let me give you a great example. An organization may say, if I have a peer reference for a practitioner, it cannot be older than 6 months old. Whereas an organization down the street may say, I'll take it up to a year. And another person may say, it's got to be 30 days or less, right? So it's the application of those specific requirements that allow the platform to do what it does.
You want to show, I know that you have some slides, some visuals, which I always love. Would you like to show the visuals?
Sure, just a couple here.
Just a
I
couple.
don't want to put the whole audience to sleep.
No, no. I think for a lot of these companies that are listening, they are going to be very, and also I want to make sure everyone knows that Anthony's websites and links, contact will be embedded below, so that way you can reach out, ask him questions, and see if the services that they're providing at Procredex can benefit your company and what you're doing. So I see, for those that are on the audio side, I see a slide, and it has 5 different bullet points, and it's called the basics. So why don't you go ahead and describe what is the basics all about?
So these are the highest level functions that we perform on the platform for our membership, if you will. So we first can organize the credentials electronically, right? And as I mentioned, that includes people, equipment, and organizations, right? All 3 of those classes of participants have to be credentialed, right? We then take those rules that I mentioned earlier, and we check for gaps in compliance. through the lenses of the organizations that are looking at that data is really important. And frankly, technically, it was extremely challenging for us to build this, right? We then obtain the credentials needed across a constituency of organizations, right? So, health insurers may have some things they need, hospitals have things they need, outpatient specialty clinics have things they need, and we get that in one place, if you will, right? We then allow organizations to bundle that data together and deliver it to their business partners in a way, as I mentioned earlier, where they know that that information is compliant with their requirements. And finally, we work directly with industry accreditors and government regulators to create a top to bottom electronic auditing and reporting process across all of our networks, right? So if you're CMS, for example, and you want to analyze credentials for a payer who's doing Medicare Advantage, rather than sending somebody out on a plane, walking into an office, pulling 20 paper files, going through them and analyzing, and auditing them, you can do it in real time and know at every minute whether someone is or is not going to fall out of compliance, right? We also, that function works in the opposite way as well, where organizations can quickly say, do I have anybody that's going to fall out of compliance today or tomorrow or next week, right? And proactively maintain that compliance rather than waiting for a biennial or triennial re-credentialing process to check for gaps, right?
And that's really important, because also, just from the cost perspective, if someone misses their, the timeline that they need, then sometimes they have to go through a longer process instead of just a fast renewal. So, on many
That's
levels,
correct.
this is really important.
That's correct. And again, I know we've talked a lot about healthcare today, but this is applicable to any regulated industry, right? And one of our fastest growing markets right now is the non-emergency medical transport industry, right? Where these are the folks that take the infirmed in vans, or gurneys or whatnot, and move, take them from an assisted living community to a doctor's office visit, to the grocery store, and then back home, right? We work directly with the industry accreditor, who is called NEMTAC, to develop an industry-wide platform for managing credentials for all members of that supply chain. So transportation providers, transportation brokers, managed care organizations, state Medicaid agencies, and so forth, right? They all can collaborate on compliance collectively and end the guessing game as to who's in compliance and who's not, and the risks that are associated with being non-compliant. Vis-a-vis, let's say something bad happens, God forbid, a person gets in a car accident in a transportation event, and the patient gets harmed, right? Well, if it's determined after the fact that that person was not adequately licensed or their insurance wasn't adequately engaged, it's a giant problem for everybody, right? It's not a problem for the driver or the patient, right? It becomes a massive liability and huge quality problem, and it can be completely avoided by proactively understanding compliance data and managing it effectively.
Why don't you show the next slide? Because I like the visuals that you have. Yeah. So what is this? Explain a little bit. Oh, for those that are on the audio side, the slide that we're looking at is titled Validation Engine, and it's showing a variety of ways that you help and serve. So go ahead and explain a little bit more.
Yeah, so as I mentioned earlier, we ingest the data in whatever form it exists in, typically from a credentialing system that's being used at a hospital or a health plan or whatnot, and we make sense of it. We organize it, if you will, and we've got our own proprietary data engine that uses both structured and unstructured data storage techniques to manage that data. Once we've made sense of it, we can then take the rules that organizations define about what that data needs to, what compliance looks like, I should say, for an individual facility or for an occupation or whatnot. And we then can analyze that data in toto and make sense of it and make those compliance determinations, right? It's a very, very sophisticated rules engine, and that uses some machine learning capabilities to make those analytics complete, right? The next thing is, we talked about earlier, is how we use distributed ledger, right? When we consume this data through our consumption engine, we immediately take everything about that data, hash it, and store it onto the ledger, right? And this creates permanent immutability and traceability and auditability for the data, right? So we can say 10 years from now, we have a credential for Dr. Smith, and 345 organizations have used that, or have verified it or whatnot. And it gives the data richness, it gives the data security and reliability, right? And what we form are not individual customers, but we form collaborative networks that bring together industry constituents in ways that have never been done before, and allow this collaboration to exist across the exchange, right? So
I like this visual. For those that are on the audio side, it shows the collaborative networks from the payers to the health systems to the physician organizations to primary sources and the consumer parties, because we often don't think about the whole economy of who needs this information and who could
that's
possibly
correct.
get this information.
That is correct. And I'll also say, I do want to show one other thing that I'm quite proud of. Our results are almost stunning. We have documented that we can show about a 75% reduction in redundant credentialing work, right? 95% reduction in credentials handling time, right? And we can complete entire organizational compliance audits in under a minute, right? And these are things that people would spend months doing, right? And it can be done in minutes or hours, right? So it's a significant value proposition, again, to the industry, not to an individual organization.
Yeah, and
Right?
as we talked about also when we were talking offline, this provides both time efficiency, so the organization can use their staff in different ways, that it's not eliminating people, it's just making the resources that each organization has more efficient, because
That's exactly correct.
technology can be used smartly, and it's why work harder when you can work smart, and if you can use the technology to help you with that, then you can actually do the analysis something more higher level. And I'm not even going to get into artificial intelligence, but it's it's the type of thing that really will I think, with staffing shortages, I think it will make it the use of this less painful for staff, because sometimes we have so many projects on our shoulders, and that all need to get done. So this is a way that you can delegate in a way that you can actually be much more efficient and productive.
The folks in healthcare, especially the folks that do credentialing, work very hard.
Yeah.
It is a very difficult and challenging job, and our goal is to not eliminate jobs.
No,
Our
not
goal is to relieve these people who do this all day, every day, of a lot of the administrative burden and redundant, unnecessary work that they do, and let them focus on the real effort, which is analyzing quality, analyzing fit, and making sure that the right people are there treating their patients, right? And getting folks who need to get to work, getting them to work more quickly, right?
Why
It's
don't
as simple as that.
go ahead and share how people would reach out to you, even though the information will be embedded, in the blog below, but why don't you go ahead and share with everyone?
Sure. The easiest way to get a hold of us is through our website, which is www.procredex.com, which will be listed below. There's a contact us page there that will send information directly to us, and we would love to have a conversation if folks are interested in how we can potentially help their organizations and their networks function more efficiently.
Are you looking for people if they're looking at, the job market?
Yeah, we're growing like wildfire right now, and we are looking for some engineering resources right now, as well as we call onboarding support folks who can help us bring on our new customers and help them digitize their data and whatnot. So if there are folks in the industry that are looking for those kinds of roles in a rapidly growing startup, environment, we'd love to talk to people.
Can the jobs be remote or do they have to be in a certain location?
We are 100% remote, the entire company.
Exactly right. I know. I
Yeah.
know. Kind of figured that, but I'd throw it out there because again, that's a question people ask. So, any last minute thoughts before we wrap up our conversation? I know we're going to have more than one episode because there's different conversations that we're going to have. So everyone, you should definitely, like and subscribe so you can stay tuned for other conversation with Anthony. But is there any last minute thoughts that you'd like to share?
I just like to reach a hand out to my team who has done an amazing job building this business from literally an idea on a whiteboard to this tremendous machine that we have deployed in the marketplace. So thank you all very much. You've done a great job.
And you know what I love about what you just said? The idea that you can actually take an idea and really think through all the pieces and make it grow and succeed. I mean, that's the entrepreneurial spirit. And
Yep.
it's very always exciting when, you hear about these stories of success. So definitely congrats on that. And for everyone who's listening, definitely, reach out to Anthony through the website that will be embedded below. And also definitely, look into becoming a member of GBA at gbaglobal.org. They are an excellent organization, especially if you're learning about blockchain and you want to network more to build up your own background knowledge. And for sure, if you have any questions, reach out to me as well at cryptomom2.com. So thank you, Anthony, for being on. And I look forward to meeting you in real life, not just on our Zoom. And thank you so much for your time.
It's my pleasure. Thank you very much for the opportunity.
Talk to you soon.